And I'm about to demonstrate to you how to do all therapy live. So first we're going to have our patient comfortable in the chair. We can offer them either pain medication or topical numbing cream, but make sure they're relaxed at least 30 minutes prior before starting your treatment. So first, once we get our patient comfortable, we'll start doing our markings. You're going to follow the jaw line going all the way back by stretching the tissue, going across the bone to mark the placement of the bone of the jaw. You're going to continue on both sides of the face, making sure that you cup it going all the way back to the ear where the mandible bone curves. Once you have that line, you're then going to mark what we call the no-fly zone. The no-fly zone is next to the mouth near the corner and the marionette lines going down. Those are areas that have nerves, and if we do hit those areas, there can possibly be some discomfort, and it can also have some side effects that we don't want with our treatment. Once she's done marking the no-fly zones, she's going to start marking going across the cheek. First, she's going to mark going across from the nasal labial side fold of the nose, going all the way back. And then she'll place her card. As she flips her card, she's going to make sure her line's going by 2 lines over meeting. As she flips, it should line up perfectly. Each side should get anywhere from 2.5 lines to almost 3. Once she is done completing her other cheek, she will then mark her chin area, and that will complete your mid-face section of treatment. So when you're doing the chin area, you do need to make sure that you are avoiding the thyroid area. So you can either have the patient swallow so that you can mark it appropriately, but you do not treat over the thyroid. So treatment in the mid-face goes about 2 to 3 fingers down depending on the size of your patient's neck area and jawline. Once she is done marking the mid-face section, she will then continue going down the neck area to show you where markings would appropriately be for your patient's treatment on the neck. Neck can also consist of anywhere from 2 to 3 sections. You do not want to go past where the line goes down the neck near the carotid or the jugular. Now we are going to show eye markings. You have your patient look up, either at the ceiling or up towards the top of the bed, and you'll put a line going where their pupils meet the top of their eyebrows. Then you're going to do a wing from the outside of their eyebrow where it ends, and then you're going to also mark where the crows meet going out towards the outer section of the face. Once you have those markings, then you can mark your no-fly zone. And that completes our markings. Once you're done doing your markings, you will then apply a gel to the cheek area in the midsection face. We're going to go ahead and take our transducer, and we're going to go ahead and see what layers the tissue of the patient has so we can see what depth we're treating. We want to make sure that we're not treating below the SMAS, which is connected to the muscle that helps give the lifting. So looking at our patient, you can see the layers of the skin on the screen. We want to look for what we call the bacon, which is in this area, which is near the 4.5 millimeter in the skin. Not everybody will have the layer that deep. Some people, you'll notice their layers at a 3.0, which is the SMAS. That is something that is targeted when patients have a facelift. So we're going to target this by doing the ultrasound, and it's all non-surgical. Wait, hold on. Don't unpause me, okay? I have to say it all over again. So once When you're scanning your patient with your transducer, you want to look at your screen to make sure you're in the appropriate area that you're treating. There's multiple areas. This area here is where our SMAS is. It looks like bacon. This is something that we're targeting on a non-surgical level with the transducer using the ultrasound. That is what's going to help lift and tighten the treatment, but you'll notice some patients will be at a different level where they'll be at a 3.0. So when you scan, you want to make sure that you're targeting the depth that's appropriate for your patient's treatment. You will be customizing this for them. Now that we've figured out our patient's depth as a 4.5 millimeter with the transducer, we're going to go ahead and start our treatment. We already have our section selected on the screen here, and we're going to go ahead and start doing our pulses. You always want to make sure and observe that you're not on the bone, that you're coming off the bone as you're doing your treatment pulses. As you move the handpiece going up, you want to do it in really small movements, only a couple millimeters as you're doing the treatment so that you get the best effect of the treatment. As you can see, we are kind of moving the handpiece back and forth just to give some comfort to the patient by moving the gel. It gives it a cool feeling on the skin. Now that we've completed the first depth of treatment with the 4.5 millimeter, you can see that her highlighted areas are collected from the midface. She's going to go ahead and change her transducer to the next level, which is a 3.0, and she's going to repeat the same areas, but on a different handpiece. Once she selects it, you'll see that it'll go to the next screen, where you then can select the cheek area, where she'll start all over again on the midface. So using similar technique, you're going to apply the gel again, make sure it's nice and fresh and cold for the patient. This part is usually a little bit more comfortable for the patient as opposed to the first section, which is deeper and a little more intolerable. So you're going to start off with your first section, and then you're going to go all the way through until you complete your midface area. Now that we've completed our last pass, which is the second one on the 3.0, we're going to make sure our patient's nice and clean and apply something nice and comfortable on the skin to just kind of relax them and calm it down. There's a little bit of pinkness and redness afterwards. We will have her sit up so you can see what that looks like. You can see our screen is fully complete with the pulses that we used on our patient. Once you're done doing your pulses, you want to make sure that you have your full line count, which is in the total here, but also by each area that you've treated. If you forgot what you've treated, you can always select the different handpiece that you used and the total that you've used in those areas. Once you're done with your computer and getting your pulses, you'll then go ahead and hit end treatment, and you want to confirm that you're ending the treatments so that way you can move on to your next patient.